The Karnataka Health and Family Welfare Department has sought strict regulation, including a possible ban on feeding pigeons in public places, citing growing health risks to residents, particularly in densely populated urban areas. The department has formally requested the Urban Development Department to issue directions to the Greater Bengaluru Authority and all municipal corporations across the state to implement specific guidelines regulating the feeding of pigeons in public spaces. In a letter dated December 16, V. Lakshminath, Deputy Secretary, Health and Family Welfare Department, urged the UDD to take immediate steps to prohibit or regulate pigeon feeding in areas where it causes public inconvenience or poses a threat to human health. According to the communication, feeding pigeons should be completely banned in sensitive locations where their presence leads to sanitation problems or health hazards. The letter states that pigeon feeding may be allowed only at designated locations under controlled conditions and for limited hours, and that the responsibility for monitoring such activities should be entrusted to charitable organizations or non-governmental organizations. The Health Department has also recommended empowering local civic authorities to take enforcement action against violations. These powers include issuing on-the-spot warnings, imposing fines, and initial legal proceedings against those who fail to comply with the guidelines. The advisory further directs municipal bodies to conduct public awareness campaigns to educate citizens about health risks associated with pigeons, applicable regulatory provisions, penalties for violations, and alternative humane methods of bird conservation. Explaining the rationale behind the move, the department pointed out that excessive pigeon droppings and feathers in high-density residential areas have emerged as a serious public health concern. The letter highlights warnings issued by medical experts who caution that prolonged exposure to pigeon droppings and feathers can lead to respiratory illnesses, including hypersensitivity, pneumonitis, and other chronic lung diseases. The department warned that such conditions can cause severe and sometimes irreversible lung damage, particularly among elderly people, children, and individuals with weakened immunity. The note also refers to similar regulatory measures adopted by the Greater Mumbai Corporation following directions from the Bombay High Court to underline the seriousness of the health risks involved. The proposed measures aim to strike a balance between public health protection and humane treatment of birds while urging citizens to cooperate with authorities in ensuring cleaner and safer urban environments.